Namaste everyone, I'm Dr. Amit here. Hope you all are doing well. Welcome back to my YouTube channel at the rate Dr. Amit official on YouTube. So it's a learning platform for NMCL exam, USML exam, MBBS exam, PG entrance exam, and over here we simplified medical sciences. So if you haven't subscribed yet, make sure to hit that subscribe button and stay connected for more easy and exam oriented videos. So in our last video, we discussed about organic acidemia. Now we are moving forward in our biochemistry series, and today we are going to deal with an important clinical topic, that is fatty acid metabolism. And it's a very important, it's a very important and exam focused topic for USMLE, PG, entrance exam, or any MBBS professional exams. So I'll explain it in a simple, clear and easy to recall you in the exams. So let's dive in and get started with our topic, fatty acid metabolism. So let's talk about fatty acid metabolism. So first we'll talk about the synthesis part. So it's occur in mitochondria. So the main first step is formation of citrate. So this acetyl coenzyme and oxaloacetate combine to form citrate. So from where this acetyl coenzyme first come. So this acetyl coenzyme come from pyruvate, that's glycolysis, then fatty acid beta oxidations and amino acid metabolism, and this oxaloacetate these actually come from the last step of TCS cycle, regeneration, or we can say that pyruvate carboxylations. And these two combine to make citrate. Why? Because this acetyl coenzyme cannot cross mitochondrial membrane, so it is first getting converted to citrate, just to cross the mitochondrial membrane. We'll see over here. Now this citrate moves to cytosol. So in cytosol, again this citrate convert themselves to acetyl coenzyme and oxaloacetate. And over here the enzyme used is ATP citrate lyase. Now let's see the steps. So where you can see that this citrate is in mitochondria. Now it's passing this mitochondrial membrane with the help of citrate shuttle, and coming to the cytoplasm. And over here the enzyme being used is ATP citrate lyase, so that again acetyl coenzyme is getting formed in cytoplasm. Now this acetyl coenzyme is forming malonyl coenzyme, and over here, and this is a rate limiting step, acetyl coenzyme to malonyl coenzyme. And over here you can see CO2 and biotin is being used. And now over here this insulin is actually encouraging this step, but glucagon is negative for this step. For this an enzyme being used is acetyl coenzyme carboxylase. Now malonyl coenzyme will form fatty acid synthesis. So over here fatty acid is being made, that is palmitate. It's a 16 carbon fatty acids. So this is all the steps. From this step in mitochondria, then citrate shuttle in mitochondrial membrane, then this is in cytoplasm. So insulin is actually helping this enzyme and glucagon is not. So it's a rate limiting step. Now we'll see here that this malonyl coenzyme, if this malonyl coenzyme increases, it will increase the fatty acid synthesis, but it will decrease the beta oxidation. We'll see in the next part. Beta oxidation will decrease, because it inhibits a carnitine shuttle. Over here this is citrate shuttle. We'll see in degradation about this carnitine shuttle. So fatty acid will not break down. So we'll continue in the next. So this is a synthesis part, right? Now we'll see the degradation part of fatty acid. So the degradation part, look, the synthesis part start in the mitochondria and everything happen in the cytoplasm, but this degradation part start in cytoplasm. Suppose in cytoplasm there is formation of fatty acid, so this fatty acid get accumulated in the cytoplasm. Activations now in cytoplasm, there will be activations of fatty acid first. So the fatty acid will add coenzyme and it forms fatty acyl coenzyme. Over here the enzyme being used is acyl coenzyme synthase. Now this will go to mitochondria. So long chain fatty acids need carnitine shuttle, like the citrate need citrate shuttle. In the same way, this long chain fatty acid need carnitine shuttle. Look in this. This now there will fatty acid, and this fatty acid will combine with coenzyme A and form fatty acyl coenzyme A. Over here the enzyme being used is fatty acyl coenzyme synthesis. It is happening in cytoplasm. Now this fatty acyl coenzyme will go across this carnitine shuttle, which is mitochondrial membrane. In synthesis we have citrate shuttle, and in degradation we have carnitine shuttle. Okay, and now this fatty acyl coenzyme coming to mitochondrial matrix. Now this fatty acyl coenzyme is getting converted to acetyl coenzyme with the help of enzyme acyl coenzyme dehydrogenase, and this is beta oxidation. Okay, and we talked over here that if this malonyl coenzyme A level increases, it will inhibit beta oxidation. This beta oxidation we are talking about this, so that a fatty acid will not break down. Okay, so if this will increase over here, then this will this enzyme will stop inhibit this shuttle, and beta oxidation will not occur. Now see, when acetyl coenzyme A formed, then it has two paths. One is it will go to TCA cycle and produce ATP and energy, and the second one is to make ketone bodies. Okay, so when ketone bodies will form, when the person will be in fasting, starvation, or diabetic state. Okay, so this acetyl coenzyme is making ketone bodies. Which ketone bodies? So we know acetoacetate, beta hydroxy butyrate, where in the liver. Okay, so this is all about the degradation part, that it starts in cytoplasm. Okay, then fatty acyl coenzyme may come to mitochondrial matrix using carnitine shuttle. Then beta oxidation is going on. Okay, and this step is can be inhibited by increasing what malonyl coenzyme, right? So this is all about the degradation part. Okay, now we'll talk about it in detail. Now let's see that fatty acid metabolism. Okay, fatty acid synthesis require transport of citrate from mitochondria to cytosol. We all know this, that this citrate is getting transferred to this from mitochondria to cytoplasm. Okay, and it's occur in liver, lactating mammary glands, and adipose tissue. Now long chain fatty acid degradation required carnitine dependent transport in mitochondrial matrix. We all know that after synthesis, this long chain fatty acid to degrade, it needs carnitine shuttle. Okay, now the first thing is systemic primary carnitine deficiency. If carnitine deficiency will be there, okay, suppose if this carnitine, okay, if this carnitine shuttle is deficient, okay, so then no cellular uptake of carnitine. Okay, then no transport of long chain fatty acids to mitochondria, then toxic accumulations of long chain fatty acid in cytosol. Then if this will not come over here, then that will accumulate in the cytoplasm. Okay, now that will cause weakness, hypotonia, and hypoketotic hypoglycemia and dilated cardiomyopathy. In the same way, when we will see that medium chain acyl coenzyme dehydrogenase deficiency, this if in this degradation part, okay, if this beta oxidation enzyme acyl coenzyme dehydrogenase is deficient, okay, then what will happen? Then decreased ability of breakdown of fatty acid. Now again the fatty acid will not getting degraded to acetyl coenzyme because this enzyme is deficient over here. Okay, and that will lead accumulations of fatty acyl. When this step will not occur, then this will get accumulate. Okay, so fatty acyl carnitate in the blood, then that will also cause hypoketotic hypoglycemia, vomiting, lethargy, seizure, coma, liver dysfunctions, and hyperammonemia in the patient. Okay, and that will lead what? That will lead to sudden death in infant and children. So how can we treat this? So we can treat it by avoiding fasting. Okay, now because if we'll do fasting, then again it will lead to what? In fasting state, more and more ketone bodies is we need. Okay, but this is not going on, so the fasting state will be more dangerous. Okay, so this step, so just remember that in feeding state the insulin will increase, fatty acid synthesis will increase, and beta oxidation will decrease. But in fasting state, okay, glucagon increases, okay, beta oxidation increases, but ketone bodies also increases. Okay, so this is all about fatty acid metabolism. Okay, so I think this is enough, this much information enough in fatty acid metabolism. Okay, so please see this video again and again. Okay, then you will understand all the steps. Okay, and after that once you understand, then you can solve any questions on fatty acid metabolism. Okay, it's a very important. Okay, so always remember these steps. Okay, remember these steps of degradation and of this synthesis. Okay, where citrate shuttle is being used, where is carnitine shuttle being used. Okay, so that will help you to understand understand all the pathway. Okay, so if you like this video, please like, share, and subscribe my YouTube channel, that is Dr. Amit Official. Okay, so we'll meet in the next video with some important topic from the biochemistry series and from other subject also. Till then, study hard, and thank you for watching.